Hello, I'm Chris Wargo from Annapolis, Maryland.
Well, hi, Mr. Diggs. We met when you were here to see the doctor. I'm Tammy, the medical assistant. Well, today we're going to go to do your wellness visit. You've already taken your height, weight, and blood pressure on the way in. And I see you completed your health risk assessment. Well, thank you. That'll be a big help.
Oh, good. Well, it is a little strange to be here and not see a doctor, though.
Oh, I can understand that. I perform these visits as part of your clinical care team, but the doctor is here and available when we need her. In this visit, I'm going to ask you a few questions about your health, medical, and family histories. These questions will also include screenings for certain conditions. Now, screening is important because finding a problem early helps you to start managing it sooner so you can stay healthier. Sometimes we can completely prevent problems if you see you have a risk. A good example of this is checking like your blood pressure and cholesterol to help prevent diseases like diabetes or heart disease. Next, we'll be working together to come up with a personal prevention plan just for you.
Oh, I didn't know all that. So preventive care isn't the same for everyone?
Oh, no, sir. Medicare requires that we check for certain things like how physically active you are, whether you use tobacco or alcohol, how much stress you have, and whether you might be having symptoms of depression or anxiety. We also check whether you're due for things we need to help you schedule, like tests to check your heart or look for certain cancers. We use all this information to create your personal prevention plan, which is based on your specific risks, your overall health, and your preference. That's why this visit is so important. It allows you to keep your prevention care plan up to date, making sure it meets your needs for staying healthy.
Well, that all makes sense. And Medicare covers that?
Oh, it sure does. Well, that was a lot of questions, but we did it.
That wasn't so bad. What now?
Well, excuse me. Let's compare the results from today to the results from last year that I printed out. You know, it does seem like you need a little more help with things at home. And your physical activity has gone down. You rated your stress higher this year too. Are you surprised by these changes?
Well, I knew I wasn't doing as well, but I wouldn't be able to tell you how or exactly why. You are right. I get out a lot less. But that's because everything is so much harder than it used to be. And my daughter has a great job and she's busy. And my granddaughter, well, she doesn't need to come over after school anymore. She's so grown now.
I'm looking at the doctor's last note. She has something here about an exercise program for you?
I forgot all about that.
That's okay. Let's look at your screening schedule and then I can get all the information together. Okay, we can give you your flu shot while you're here. Would that be okay?
Well, that would be very helpful. And one less trip.
You had a colonoscopy 5 years ago, so you shouldn't need a colon cancer screening for another 5 years.
Well,
Let's see.
my sister had a lung cancer test. Is that something I need?
Well, let's look at the Medicare preventive services requirements. Okay, here we are. Lung cancer screening is recommended for people who have a history of smoking at least 20 packs a year and quit smoking in the last 15 years. Well, I think earlier I wrote down that you smoked a half a pack a day for 10 years, and that's about 5 packs a year. And stopped smoking 25 years ago, but you stopped smoking 25 years ago.
Smartest thing I ever did.
Yep. It also means that you don't need to have that screening test. So all is good. guess you're in pretty good shape.
Oh, I'm in pretty good shape for the shape I'm in.
Okay, it looks like you're all set. I've used all of the information we've talked about to come up with the prevention plan we talked about earlier. I got the printout of your plan and all the requirements right here for you. The doctor is going to come in and go over it with you, along with your advanced care plan. Take a minute to look this over and think about any questions you have for her. I put the information about the exercise program on here too. There are other locations, so if this isn't convenient, I can look for other ones.
Okay, let me see. Wow, this looks great. Thank you so much.
Oh, it's my pleasure. It was nice to meet you today. The doctor will be in momentarily to answer any questions you have about the plan. She's also able to discuss your advanced care plan. If that's something you're interested in.
Well, thank you. Oh, it was nice meeting you today. Thank you again.